comment on that value of a team helping patients with TOS?
I couldn't agree more. I mean, I think that it takes a village to take care of patients, and you have to have a team of people that you can work with. You can talk if I've got a question about a particular patient, maybe I call you up and I say, hey, I need a variation. I mean, we need to do it a little bit off the normal menu because this patient has slightly different symptoms than normal. We got to image them in this slightly different position. And when you have people who understand the anatomy and they're imaging and can help tailor the treatment to the individual patient, then you can really help a larger swath of people. But I also think that the key is you got to find people who are bridge builders, not dam breakers. And that, so for example, I do my surgeries with vascular surgeons. So we're actually working, there's a vascular surgeon on one side, neurosurgeon on the other, doing the operation together. And then that allows us to communicate. We share patients, we share information, we share insight. They teach me, I teach them. And that spreads knowledge instead of keeping knowledge in a silo where you're doing the same thing over and over and nobody's telling you that maybe there's a better way or maybe some of the things you're doing aren't working.
Also, for example, if I ask you, Art, why do you need to get this piece of information? Why does this make a difference? You know, I have to challenge myself. When you say to me, Scott, I don't get this, right? I have to learn something. I have to figure it out.
Right. No, it's definitely pushing each other is a much better place than getting complacent and doing the same thing over and over and thinking everything is just fine.
As shown by your new minimally invasive approach. Something that wouldn't have happened if you did the same thing for 20 years.
Right.